Okay, Prof, it's okay. Okay, maybe I want to show you my slide. Okay, here's our guest professor today, Professor Noriyuki Koibuchi, a professor and director Department of Integrative Physiology, Gunma University, Graduate School of Medicine. He has a research specialty in endocrine and environmental physiology, and also he has a clinical specialty in endocrinology and metabolism. He is a registered diabetologist. As you know, so far we have often used problem-based learning method, Prof, when we are faced with learning related to the case in scenarios. But today we get the good opportunity to learn directly from you about team-based learning, a collaborative learning method, and teaching strategy with the structure process to increase deeper student involvement, yeah, Prof, yeah, and improve the quality of the students' learning. Okay, Prof, without further ado, now you can start your session. The time is yours.
Okay, thank you very much. Okay, again, good morning, students. I'm Professor Koibuchi from Gunma University. It's my great pleasure to see you, although it's online. Actually, I wanted to recruit Gunma University student as well, but at this time, the time was limited. So it was quite recently when I was asked to give this kind of a lecture. So I did not have enough time to ask my student, but last year, I recruited several students from Gunma. It was very enjoyable. But this time, maybe next time, I will recruit some students from Gunma. And also after Corona pandemic, you can visit us if you want to. Yeah. And we have agreement of student exchange program already. So hopefully we can see you face to face in the near future. Okay.
Yes.
So let me share my slide. Okay. So before we start scientific session, I'd like to introduce my place, which is Gunma, which it is located about 100 kilometers north from Tokyo. Compared to Indonesia, it is very cold. Actually, it's snowing right now. It's really cold right now. The temperature is about 2-3 Celsius right now. Anyway, this is Gunma. We have a lot of snowfall in Gunma, and we have very nice foliage in autumn. And actually, I went to mountain climbing yesterday. It was so beautiful. You know, snow started to melt. And also interesting thing is hot spring. We have a lot of hot spring spa. And this is one of the largest hot spring spa in Japan. The problem could be you have to be naked. But once you get used to it, you can really enjoy bathing the hot spring. And most of all foreigners likes to bathe in. And we have a lot of festivals. This is a kind of traditional festival wearing samurai costume. We also have bonfire dance festival. And also we have a lot of fireworks in summer. And also we have a close relationship with Latin America. We have a lot of immigrants from Latin America, like Brazil, Colombia, Peru, and Bolivia. So we have a Latin American festival as well. And this is the Gunma University School of Medicine, which is located in the capital of Gunma, which is Maebashi. And this is our university. And Gunma University was founded at Maebashi Medical College, 1943. And then we have been transformed to Graduate School of Medicine at 2003. Graduate School of Medicine means we are research-oriented university rather than teaching-oriented university, although, of course, we are doing teaching very intensively. But also we have a lot of research labs. And this is University Hospital. We accept about 700 patients. And we have a lot of imaging tools, PET, SPECT, MRI. And we have a heavy metal ion therapy center, which is world famous center. Just a second. A second, I got phone call. もしもし。先生、ごめん。今ね、TBL の授業中なんでごめんなさいね。はいはいはいはい、どうも。Sorry.
Okay.
So this is heavy metal ion therapy center, and this is only 3 all over the world. And we have, of course, skill lab training center. Also, we have more than 40 research labs, and we usually have 500 publications per year, including Nature, Science, Lancet, JBC, Cancer Research, Blood, Endocrinology as well. So if you are interested in doing research, you could come to Gunma also. Okay, so Professor already introduced me, but I would like to introduce myself again. I'm Noriyuki Koibuchi, but you can just call me Nori because Noriyuki is too long, so just call me Nori. I was born in Maebashi and grew up in Hitachi, Ibaraki Prefecture. Probably you have heard the name Hitachi because this is the Hitachi is the name of one of the biggest electric company in Japan, and this company was born in this city. So I'm a professor and director of the Department of Physiology, Gunma University Graduate School of Medicine, and as she introduced my research specialty, endocrine physiology and environmental physiology. But of course, I teach other area of physiology as well, but digestive physiology, renal physiology, cardiovascular, respiratory, or whatever. And also, I regularly see patients as the registered diabetologist. Okay. So today, we're gonna do the TBL, and probably you already started using the TBL in your class, and TBL is small group learning that emphasize student preparation, the class, and the application of knowledge in class. And the students organize into diverse teams, 5 to 7 students that work together throughout the class. Students should prepare by self-study prior to class. I believe you have already prepared for TBL. And today's schedule. So right now I'm introducing my class, and then after that, I'll give you 10 questions. So I will upload the exam through chat. And after that, we have a 20-minute group discussion. And please camera on during the test and the discussion. Then after that, we have a first study session, and we can confirm if your answer is correct or not. So one representative student of each group send the answer through chat, okay? And if all answers are correct, we proceed to the next question. If different answer comes out, I'll randomly ask reasons, okay? And after that, I'll present today's case, and the case will be uploaded again through chat. And then we have group discussion in the breakout room again. And please share the conclusion together because I will randomly ask you to reply, okay? I'll pick up student to answer by myself, okay? It is not you who volunteered to answer, okay? And the reply of one member is graded as a score of all members of the group, okay? And then we do the other study session, which is gonna be 40 minutes or longer. As shown above, I randomly select student to reply. And then after that, I'll do the brief summary and conclusion maybe in 10 to 15 minutes. Okay. So, oops, sorry. I will upload the question to you. Just a second. Okay, everybody, please camera on. And you are not supposed to refer any textbook or website, okay, during the test. Okay, I'll upload the exam. Okay, so you can download my exam. And from now on, I'll give you 10 minutes to answer. Okay, so you can start answering question. So please camera on and start. And you have 10 minutes. Okay, please start. Everybody can download. If someone cannot download, just let me know or let teachers know. Everybody can download. Okay.
Semua bisa ya, Dek, download ya?
Bisa, Dok.
Oke.
Please camera on, please.
Mohon ya adik-adik mahasiswa supaya kameranya di ini ya. Jangan di stop videonya ya.
Kausar Ahmad, videonya ya, Dek. Kausar Ahmad, videonya. Oke. Habibillah kelihatan tuh, kelihatan. Oke.
You are not supposed to cheat. Okay.
Yes, Prof.
Iya, Prof.
And for second group student, I allow you to watch the first TBL session. But remember, the exam is completely different.
Yeah.
And clinical case is completely different.
Yeah.
So you cannot remember the answer, okay?
Yeah, Prof. Prof, after this you will join the breakout room 8:15 maybe?
Yeah, maybe.
8:15, okay.
So 10:15 out in your time. 8:15, right?
Yes.
8:15, we can start the breakout room.
Yes, okay.
So from 8:15, we're gonna start breakout session. So you can discuss with your group members whether your answer is correct or not. Then after breakout session, representative student can send the answer of the group through chat to me. Okay, I'll let you know. Okay. And during breakout session, I'll circulate each room. So once I show up, try to discuss in English. Okay. I do not understand Indonesian. So even during the discussion session, I encourage you to discuss in English rather than Indonesian. Okay. When Guma University student present, but unfortunately this time I could not recruit Guma students. So you may discuss in Indonesian, but it is not the ideal thing to do. Okay. Please try to discuss in English. So everyone finished already? Anyone who has not finished yet? We're gonna move on to the breakout room in 1 minute. Everyone finished?
1 menit lagi ya, Dek. Kita masuk ke breakout room.
It's only 10 questions.
Yeah.
And it's pretty easy one. So everyone ready to move on? Okay. So many people, many students nodded. So okay, let's start the breakout session.
Oke, Prof. Adik-adik masing-masing bisa join ke grupnya masing-masing ya. Ada grup di situ, ada alpha, beta, dan delta. Silakan join.
You understand what I'm talking about? This is the schedule that you gave me, but as you show in number 6, there is no study session number 1. So without study session number 1, you move into the case presentation. So there should be 20 minutes study session. So something seems to be wrong. The PDF file you gave me.
Ya, Prof.
Yeah. So could you tell?
Yep.
So students have this slide as well. If student has this schedule, then please correct, because there is
Okay.
no study session here.
Oh, okay. There's no study session here. So after it is 20 minutes for group discussion 1, and
yes,
then
please.
And then
So 20 minutes study session.
20 minutes study session.
Yeah. Otherwise, student cannot answer the question.
20 minutes ya, Prof. Okay, I will write it.
So please make correction if student also has this timetable.
So study session is 20 minutes.
Yeah.
8:35, and then Is it right, Prof?
Not 9. Not 9:55.
Oh, okay. 8:55. Presentation, 10 minutes?
10 minutes is enough.
Okay. Twenty minutes, ya, Prof?
No. This
No?
should be long. This should be long.
Oh, should be long. So,
Group discussion should be like
45?
50 will be okay.
50.
50 will be better.
Okay, 10 o'clock. 10 o'clock, Prof.
Yeah, that's fine.
Okay. We'll have a toilet break. 10 minutes.
Yep. Okay.
And then study session.
This will be 1 hour.
1 hour.
Or less. Yeah, it should be okay. 1 hour will be okay. Yeah.
And then brief summary. 15 minutes.
Yeah, 15 minutes will be fine. Could be longer, depend on the answer of the student. But this is
Yeah.
roughly this is fine. Okay, thank you. Okay, so breakout room will be finished soon.
Okay.
So just tell everybody that the breakout room will finish in 1 minute.
Okay, Prof.
Okay, welcome back, everyone. Everybody, come back. Looks like.
Yes, I think almost all
Okay,
students are
everybody. Okay, everybody come back. Welcome back. Okay, so we'll start the first study session. So I will ask. Don't send me right now. Okay, I will ask to send the answer, correct answer that you thought about per question. Okay, so when you send your answer, just write the group number and the answer. Okay, so only one representative student per group can send me the answer. Okay, so do not forget to write down the group number as well. Okay, so we can start. Okay, we can start the study session. Okay, question 1. Metabolism in the body weight, body means what? Okay, send me the answer.
Jangan lupa tuliskan kelompok,
Yeah,
nomor, dan
through chat.
jawabannya, Dek.
Just write down the group number and then answer. Send me through chat.
Perwakilan kelompok aja ya, Dek.
Okay. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Still some group has not yet answered. I got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I got answer from the 10 groups.
We have 11 group
Right.
here.
You have 11 group, right?
Yeah.
Good. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, 11. Okay, most group picked up E. Okay. The whole chemical reaction induced by in various organs, but 2 groups selected A. Okay. So the correct answer is E. Okay. Of course, chemical reaction to produce ATP is a part of metabolism, but metabolism indicate not only produce ATP, but a process to catalyze ATP is also part of metabolism. Okay, so the whole chemical reaction. No, sorry. Oh, not sorry. E is not correct as well. Okay, if you say the whole chemical reaction is in various organs is not metabolism. For example, if you take salt, salt will dissociate NaCl can dissociate into Na and Cl, right? Do you think, oh, sorry, this is for all of you. Okay, so if NaCl dissociate into sodium ion, chloride ion, right? If you ingest NaCl, do you think this is a part of metabolism? Actually, it is not. So you have to, if you say metabolism, such reaction should be associated with energy transfer. Okay, so the correct answer is B. Okay, so chemical reaction to produce ATP or to use ATP. So all chemical reaction associated with energy transfer is metabolism, okay? Just ingest sodium NaCl, and which is dissociated into sodium and chloride. This is not considered as the metabolism. Okay, understand? All right, so we're gonna move on to the which is okay. We're gonna move on to the question two. Okay, question two. Send me the answer. Question two. Send me the answer. One, two, three, four, five. One, two, three, four, five, one. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, there are two different kind of questions. Some group said D, thyroid hormone hypersecretion. Some group mentioned A, starvation. Think, okay, based on question 1, when you are starving, what's happened if metabolism is increased? Understand? Can anyone, okay, so I'll ask someone. Okay, someone who said A, okay. Group B6, Thiahid, Alif, could you tell me why you selected A? Mic on and tell me. Can you tell me?
Wait a minute, Prof.
Yes, sure.
Okay. Because systemic metabolism is active when the starvation happens in our body. This means our body do to produce ATP more to help starvation, to help us from starvation.
Okay, if the metabolism is activated during starvation, our body energy will be consumed so greatly. Okay, so usually during starvation, we try not to consume so much energy. Okay, otherwise we'll get slim. You understand? So the
Yes, Professor.
starvation, there is some activation, of course, to produce glucose, but usually during starvation, we try to not use too much energy. We are trying to save the energy during starvation. Understand? So the correct answer is D, thyroid hormone hypersecretion. Okay, cooling the body also. Okay, of course, we are trying to produce some heat during cooling, but the whole metabolic process is not activated. Okay, cooling, decreased temperature can decrease the chemical reaction. Okay, ACTH also, ACTH decrease the secretion, ACTH can decrease the metabolism. And activation plus sympathetic nerve also, they are trying to save energy, but the whole metabolic process is decreased, okay? Some part metabolic process could be activated, but if you think about systematically your whole body during starvation, we need to save the energy, okay? Okay, number three. Which substance mainly bind with membrane receptor? Okay, go ahead, number three. Okay. Okay. Anyone else? Okay. Everybody seems to get the correct answer. Okay. Okay, thank you very much. Everybody got a correct answer. Yes, acetylcholine bind to membrane receptor. Other hormones bind to nuclear receptor or intracellular receptor. Okay, everyone correct. So we can move on to the next question. Question number 4, which of the following is not a common mechanism of action of nuclear hormone receptors? This is really difficult actually. Okay, question number 4. Question number 4, please. Only one answer? How about other groups?
Ada nomor
E. Oh. This could be difficult. Okay, I'll let you know later, but please remember, nuclear hormone receptor react completely different with or without ligand, okay? With ligand, in many cases, you understand ligand, right? Everybody knows, like you don't know the ligand? Ligand is a hormone. With ligand, usually in many cases, activation. Okay, without ligand. Okay, so with the ligand, nuclear hormone receptor activate transcription in many cases, but without ligand, it suppresses the transcription or no effect. So function is altered upon binding to ligand. So this is very common idea. So number A, so binding to DNA is common idea, right? And also binding cofactor is also very important function. So it is not nuclear receptor itself, but nuclear receptors have to bind with cofactors to activate transcription. So B is also correct. C, forming homodimer, this is not common, okay? Nuclear receptor sometimes bind with heterodimer, or sometimes bind with homodimer, or sometimes binds as a monomer. So number C is not common mechanism, okay? And histone acetylation is modulated by nuclear hormone receptor. So C is the correct. So C is the answer. Okay, number 5, go ahead. Question number 5. D. Okay. Okay, all groups seems to get a correct answer. Yes, of course. Sympathetic nerve activation induced the body temperature increase, and in other activated by parasympathetic nerve. Okay, so everybody got a correct answer. So I'm not gonna talk too much about question number 5. Okay, question number 6. So which neural cell body is in the hypothalamus? Okay, question number 6. Go ahead. Looks fine, looks fine. Okay, great. You did quite well. Okay. D. Yes, of course. Great. Everybody got a correct answer. Anyone else? Okay, everybody get an answer? Yes, of course. It is only dopamine whose cell body in the hypothalamus. Leptin is adipocyte, insulin, beta cell, the pancreas, prolactin, anti-pituitary, aldosterone, adrenal cortex. So only dopamine cell body is located in the hypothalamus. Okay, question number 7. Which hormone is involved in positive feedback of certain hormone? Sometimes in many hormones, act in negative feedback manner, but under certain conditions, some hormone will act as positive feedback. Okay. Question 7, answer. Question 7. Go ahead, question 7. Could be difficult also, but this is a very important idea. Certain hormone is involved in positive feedback at certain point. Could be difficult. So you haven't received a reproductive physiology yet? They have received a lecture of reproductive physiology? Not yet? Yeah, some got a correct answer, but not all. This is very important mechanism of hormone action. Okay, well, time is, actually, I spent longer time than expected, but I need to explain a little bit. Okay, this is a very important step that you should understand. This is very, very important step that you should understand. Okay, so think about LH search. During ovulation, LH increase, right? Everybody knows LH, right? Okay. Luteinizing hormone secreted from ovary. Okay, LH. So LH is usually suppressed by excess amount of estrogen. However, before ovulation, estrogen secretion is increased like this. Secretion increased right before LH surge. Estrogen secretion also increased. Okay. Estradiol secretion increase, which activate LH secretion. Okay, so estrogen before ovulation, estrogen activates LH as positive feedback. Okay, this is very, very important step that you have to remember. Okay. Okay. Question number 8. Appetite is increased by which? Okay. These hormones regulate appetite. Go ahead. Question number 8. Only one group. E, 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 E. E. Okay. Okay, good. Everybody understood. Okay, it is only ghrelin which increase appetite. Other hormones suppress the appetite. Okay, so I will not talk anymore any longer. Okay, question number 9. Uncontrolled diabetes mellitus increase ketone body due to an increase in which one? Question number 9. Question number 9. Go ahead. E, 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 E. Wonderful. Okay. Okay, all group got a correct answer. Yes, of course. Uncontrolled diabetes mellitus induce the catalysis of triglyceride. Triglyceride catalysis cause activation of beta oxidation. Catalyze the fatty acid, which produce the large amount of acetylcholine. So, acetyl-CoA. So excess amount of acetyl-CoA can produce ketone body. Okay, last one. Which of the following is not the action of thyroid hormone? Number 10. Go ahead. Okay, good. Okay. All group got a correct answer. Thank you very much. Wonderful. So in summary, again, please keep in mind about the meaning of the metabolism. Okay, actually, to many Japanese students also got a same mistake. Many people consider that chemical reaction in this various organ, whole body is considered as a metabolism, but the metabolism means chemical reaction together with energy transfer. Okay, you have to use ATP or you have to synthesize ATP through metabolism. Okay, just catalysis of sodium chloride is not considered to be the metabolism. And the during the systemic metabolism, systemic means whole body metabolism is activated when thyroid hormone is active, or after meal, you need to increase the metabolism to store the energy. Okay, but when you're starving, if your metabolism is very much activated, then you may start to die, right? Of course, in some organ, metabolism is activated, but as a whole body, you need to save the energy during starvation, okay? So these two, please keep in mind. All right, we're gonna move on to the clinical case presentation. Okay, I'm gonna send you today's clinical case. So you can download. Okay. Okay, please download. So case one for today is hyperthyroidism. After we are greatly behind the schedule, unfortunately, it took some time to answer question. Okay, everyone downloaded? Okay, we're gonna start. Okay, so today's clinical case is hyperthyroidism or Graves' disease. This is a pretty common disease all over the world, particularly for girls. In Japan, usually one patient per 100 girls is seen. So case is a 90 years old woman, university student. I don't know which university, could be Gunma, could be Sriwijaya, started to feel hot about a month ago. Even her friend around her felt cold. Okay, a lot of sweating occurred even in an air-conditioned room. Although she was eating more, she lost 5 kilometers in 2 months. She played the trumpet in the brass band club. However, when she tried to make high notes, she started to have palpitation and shortness of breath. A friend pointed out that anterior neck was swollen, anterior neck here, right, swollen. Taken by a worried friend, she visited Dr. Noriyuki's thyroid outpatient clinic. Physical finding at the visit, height 160, weight 48.5 kilogram, body temperature this, pulse rate this, blood pressure this. Okay, so this is laboratory test finding. Serum TSH, very low, reference value. Free T4, this. Free T3, this. TSH receptor autoantibody positive. So she was diagnosed with hyperthyroidism due to Graves' disease and was given better adrenergic receptor blocker and thiamazole. Unfortunately, however, even after 6 months, the medication was not very effective. The palpitation was strong and her weight was further reduced. Therefore, a partial thyroidectomy was performed. Immediately after the operation, conversion began to occur mainly in her fingers, like this. So emerging blood test was performed. As a result, the total serum calcium concentration was 7.2 milligram per deciliter. And discuss following questions. So list abnormal finding physical symptoms and explain the mechanism causing such abnormalities. I will ask symptom piece by piece, okay? Calculate body mass index. What is abnormal range? What is the difference between free T4 and total T4? Or free T3 and total T3, okay? So free, and I would like to ask you the difference between free and total. The why free hormone were measured instead of total T4, okay? You could measure total T4 or total T3, but in this patient, only free T3 and free T4 was measured. Why? Regarding laboratory finding, explain why these values were obtained. Explain why beta-adrenergic receptor blocker and the thiamazole were given. And explain why calcium level dropped after surgery. Why decreased calcium induced conversion? Okay, and I have heard that you have not heard about the thiamazole, so I'll give you a hint. Thiamazole can thiamazole is an inhibitor of thyroid peroxidase. Okay, so why thyroid peroxidase should need to be inhibited? Okay, this is question. Okay, so I'll give 50 minutes. So let's move into the breakout room again and answer these questions. Okay.
Dede, silakan join ke breakout room. 50 minutes ya, Prof?
Yeah, 50 minutes. And if you guys don't finish in 50 minutes, then we need to extend the time.
Iya, Prof.
Okay, please go ahead.
Sekarang silakan join ke breakout room masing-masing deh.
Okay, shall we start now?
Okay, Prof, we will push them to the back.
Yes, please. Okay. Hi, okay. Still, we have to wait one more group, I guess. Okay. Okay, everyone, welcome back. So we're gonna move on to the discussion. How was the case? Was it difficult? This is kind of typical case of hypothyroidism. And you have to know the mechanism, particularly you have to know the thyroid hormone action, right? And I already wrote down the hint in the clinical case. Okay, I'll share the screen. Okay, let's repeat the case again. Okay, 19-year-old woman, university student, started to feel hot about a month ago. When her friends around her felt cold, a lot of sweating occurred even in an air-conditioned room. Although she was eating more, she lost 5 kilograms in 2 months. She played a trumpet in the brass band club. However, when she tried to make a high note, she started to have palpitation, shortness of breath. A friend pointed out that the adrenaline was swollen. Taken by a worried friend. She visited Dr. Noriyuki's thyroid outpatient clinic. And the weight, body temperature, pulse rate, blood pressure, laboratory test findings, serum TSH, free T4, free T3, TS receptor antibody positive, and hypothyroidism due to Graves' disease, beta-adrenergic receptor, and thiamazole. And then, but unfortunately, her symptom was not relieved, so she took the surgery. After the surgery, she had the convulsions. So there are a lot of things that you need to discuss. Okay. So before we start talking about symptoms, I want someone to explain. Oh, sorry. To explain the I want someone to explain about the oxidative phosphorylation. Oops, doesn't work. Sorry. I want someone to explain to all the oxidative phosphorylation. Okay, I make my eye closed and point at someone. Okay. Group B5, group B5, Eva, Lianti, could you explain the oxidative phosphorylation? What is this? Eva?
Well, thank you.
Yes.
Thank you for the times,
Yep.
Prof.
Yes.
So I think oxidative phosphorylation is how our body try to gain energy or ATP from the cells, sir.
Okay, yes. Oxidative phosphorylation is procedure to produce ATP. You're correct. Wonderful. Okay, so based on, so thyroid, as everybody knows, thyroid hormone activate oxidative phosphorylation, right? So as a result, several kind of symptom is induced. But there is some reason why such kind of symptom is induced. Okay, thank you very much, Eva. Okay. I'll move on to other group. Okay, D15, Vito Ananta, could you tell me, could you pick up one symptom and tell me the reason why such symptom is induced? Vito Ananta.
Yeah, thank you, Professor Koibuchi.
Okay.
I'm sorry, one of the symptoms of hyperthyroidism, right?
Yes, just pick up one symptom that patient's shown. Okay.
One
In
of
this
the
case,
symptoms
yes.
is weight loss.
Weight loss, okay.
Which is caused by the hypersecretion of thyroid hormone.
Yes.
That induce an increase in basal metabolic rate.
Yes. And
I'm sorry?
Well, it is true that thyroid hormone increases basal metabolic rate, but why weight is lost by the increase of basal metabolic rate? This is my question. It's difficult.
I'm sorry, I can't hear.
Okay, so the increase in basal metabolic rate can reduce the body weight. My question is why increase in basal metabolic rate can decrease the body weight?
It's because of the acceleration of the body's metabolism, Prof.
Yes. So the body metabolism induced the decrease in body weight. Still, there is some gap.
The increase in metabolic rate it increases the body's needs to metabolism, and
as a result, it's difficult, right?
yeah.
Okay, so
I did Google this already.
yeah, you know, your answer is correct, but still there is some gap between increase in basal metabolic rate and decrease in body weight. Okay, I'll move on to other group.
Yeah, thank you.
Okay, great. Okay, group B7. Often, could you tell me increase in basal metabolic rate? How increase in basal metabolic rate induce a decrease in body weight? Alvin, can you guess?
Yes, hello, Professor. Can you hear me?
Yes, sure.
The increasing metabolism rate is happens because of the thyroid hormone or
Yes.
T3. It increases the oxygen uptake in the mitochondria of the cells. So when cells need more oxygen, so an increase of metabolism rate is happening. So the body is losing its weight. I think that is what happening to the patient here.
Okay. Patient, hyperthyroid patient become very slim and feel fatigue. Okay. And their power is decreased. Why? Increase in metabolism induce what? I need to know the more direct answer. Maybe difficult. Okay, I'll move on to some other group. Group A4, Afifa. A4, Afifa.
Yes, Prof.
Yes, can you guess?
I'm sorry. Prof, can you repeat the question?
Increase in basal metabolic rate can reduce a body weight. I want to know the mechanism. Somebody said oxygen consumption is increased. That is true, but still there is no direct reason why body weight is decreased by the increase in basal metabolic rate or increased oxygen consumption. Why body weight is decreased?
Well, I want to try answer the question.
Yes.
In the book, I read that increased hormone production is very high in this case. So increase okay. Increased hormone production is very high. So this hormone can cause loss weight and very large drop in thyroid hormone. Always effect on increased body weight. This effect then don't always occur, but because thyroid hormone also increase appetite, and this may be balanced against change metabolic rate.
Okay, everybody said it in the same way, but no one still cannot tell me the direct reason why body weight is decreased. Decrease in body weight is induced by loss of weight of organs, right? So let's see. We can share the slide. Okay, I can share the slide, this slide. Can everybody see this slide? So this is a kind of a whole metabolic pathway in body, right? So increase in metabolism, basal metabolic rate can induce breakdown of glycogen, breakdown of triglyceride, and I did not mention, but also it can include also amino acid. Amino acid is also goes into this TCA cycle. So increase in basal metabolic rate can induce breakdown of glycogen, triglyceride, and protein into amino acid, which can be used to produce energy, right? Everybody understand? So you have to know the symptom induced by induced by the increase in basal metabolic rate. So decrease in triglyceride cause the decrease in body fat mass, right? And increase in muscle breakdown to produce amino acid can decrease the muscle mass. Understand? So that's why body weight is decreased in hyperthyroid patient. Indeed, you have to know the mechanism, but you're going to be a doctor, right? Clinicians. So you have to know the reason of the symptom, direct reason of the symptom. Otherwise, you cannot cure the patient. You understand, right? Okay. I'll give this slide later. Okay. So let's move on to the next question. Okay. Okay. Group A3. Balkis, could you pick up one symptom and explain the reason? As I mentioned, if you can mention the direct reason, it will be better. So Balkis, could you tell me the reason, symptom, pick up symptom and the reason why? Balkis.
Yes, Prof.
Yes, please.
Can you repeat the answer, Prof?
Could you pick up one symptom induced by hyperthyroidism and explain the reason?
Hyperthyroidism is most commonly caused by Graves' disease and
No. I'm saying that pick up one symptom, clinical symptom of the patient in a clinical case, and tell me the reason causing this clinical symptom.
Sweating.
Sweating, okay. Why sweating induced?
why sweating is because hyperthyroidism is most commonly caused by Graves' disease and produce TSI and LUTs targeting the TSH receptor, uncontrolled growth and production.
Oh,
And
this
then,
is, yes, this is written in textbook, but what is the reason causing sweating? I want to know the direct reason causing sweating.
it is increased heat production, Doc.
Heat production, yes. Heat production is increased. That's true, that's correct. So why heat production was increased? Next question. Can you guess? Difficult? Okay.
Rapid metabolic abnormalities.
Yeah. Why heat production is increased? Okay, I'm gonna move on to other group. Okay.
Thank you, Prof.
Okay, thank you. A2.
Welcome.
Fitri. Fitri. Can you hear me?
Fitri, silakan di-unmute, Dek.
Can you tell me why sweating is induced?
Yes, Prof.
Yes, please.
Yes, these disorders occurs when the thyroid gland produces to most of the hormone thyroid, which can increase metabolism and cause rapid, irregular, or founding habit. Thank you, Prof.
Okay, heat. Okay, it's a okay. It is not wrong, but not direct. Okay, I'll move on to the group D14. Naila. Naila, could you tell me the mechanism causing sweat or high body temperature?
Yes, Prof.
Yes, please.
Hyperthyroidism may cause sensitivity to heat and excessive sweating, where a person suffering from hypothyroidism may struggle to keep warm at all. When the body's thyroid is working properly, its cell will produce 65% energy and 35% heat. However, those with a thyroid condition will either be producing too much or not enough thyroxine. This change in hormone levels will confuse the body into producing either too much heat and not enough energy, or vice versa.
So sorry, I do not understand pretty well about your experience. So heat is produced by what? Heat is
Sorry, Prof. Can you repeat?
Heat is produced by what? How heat is produced? Of course, thyroid hormone can produce heat. It is true, but what is the mechanism causing heat by thyroid hormone? Can you guess? Or still you need to think about it?
High metabolism.
Yes. High metabolism, yes, that's true. But this is not direct reason why heat is caused.
The increased rates of oxidation are accompanied by increased production of heat per unit of time, even when deficiency is normal.
Okay. Heat okay. Apart from thyroid hormone, how our body heat is produced? Anyone can answer through chat? Anyone can answer through the chat how our body heat is produced? This is one of the fundamental things in physiology. How our body temperature is maintained apart from thyroid hormone. Can you tell me through chat? Nutrient oxidation ATP. Oh, that's a good answer. Anyone else? This is a good answer. Anyone? Only one answer? Regulated by hypothalamus. Yes, this is hypothalamus. Also, sympathetic nervous system is activated by thyroid hormone. Yes. So the hypothalamus, thyroid hormone activates sympathetic nerve terminals, particularly in hypothalamus. This is great. This is so the thermal regulation system could be altered, but this may not just one thing. How our body heat is produced? Anybody tell me? Yes. It is very difficult to vasodilation. That's good answer. T3 increase basal metabolic rate, yes, but these are not direct cause to produce heat. How heat is produced? What is the direct action? Cryogenic, yes, cryogenic effects, that's true. Yes. Yes, muscle contraction, yes, but still not direct reason. But the enzyme, yes, right. But okay. But okay. So heat, everybody can tell me the too sophisticated answer. Okay, heat is produced by ATP breakdown. Right? Heat is produced by ATP breakdown. So breakdown of ATP can induce enzymatic reaction, right? Such as phosphorylation of seroproteins, activation by enzyme. However, energy utilization rate is not so great. Energy utilization rate is not so good. So the more than 70% So the more than 70% of energy produced by ATP breakdown goes to heat, causing body temperature to increase. Okay, this is the main reason why our body temperature increased by hyperthyroidism. Okay. Okay, we're gonna move on to next symptom. Group B6. Nianyu. Am I pronouncing correctly? Nianyu. Group B6. Could you pick up one symptom and tell me the mechanism? Can you hear me, Nianyu?
Yes, Prof.
Yes, please.
Maybe palpitation.
Palpitation, yes. Okay. Could you tell me the reason? Yes.
Palpitation because activate sympathetic nervous that increase heart rate and contraction range, so that palpitation happens.
Great.
Nervous
Yes.
stimulates by thyroid hormones.
Okay, yes, palpitation is induced by the activation of sympathetic nerves. This is one reason. There is other reason why palpitation is increased or increased heart rate is induced by thyroid hormone. There is other reason. Okay, group A1. Alia Ramandani, could you tell me other reason? Sympathetic activation of sympathetic nervous system is reason, but there is other reason why heart rate is increased. Alia, can you guess? Alia, can you hear me?
Yes, Prof.
Yes, please.
Wait, Prof.
Sure, I'll wait for you. If you need some more time, just let me know.
The answer is palpitation sensation of a rapid or irregular heartbeat are most often caused by cardiac arrhythmia or anxiety, Prof.
Yes, that's true. So the excitability could be altered. This is one reason. But there is other reason why the heart rate is increased in hyperthyroidism. One hint is increase in oxygen consumption that someone told me already. Why increase in oxygen consumption cause increase in heartbeat? Okay, group D13, Angelica. D13, Angelica, could you tell me why increase in oxygen consumption cause increase in heart rate?
Professor, for the opportunity. I will try to answer. Maybe because of the stress response.
Could you say it again?
Increase of the stress response.
Increase in oxygen consumption requires more oxygen, right? In each tissue. increase in oxygen demand. Oxygen demand is increased by the increased oxygen consumption in tissue or in cell, right? So under such circumstance, why heart rate increased? Can you tell me? Difficult? Okay, so I'll ask someone else. Okay, so anyone can tell me in the chat? Can you tell me why increase in oxygen consumption can produce the increase in heartbeat? Could you write? Okay, yeah. As I told you, cardiac function is increased. Heart pacemaker is, but this is not direct reason. Sympathetic nerve activation is one reason, but you miss, a lot of people miss the most important phenomenon, most important function. Increase in heart rate, usually increase in heart rate is induced by what? Like if you're running, your heart rate is increased, right? Because during running, your oxygen consumption in tissue is increased. Understand, right? That's right, yes. Okay. Yes, okay, few people answered the correct answer. Yes, increased demand for O2, then hyperventilation is induced. Okay. Increase in oxygen demand can cause hyperpalpitation, right? Understand? Because oxygen consumption is increased in each cell, in each tissue. So blood should deliver more oxygen to each tissue, right? Okay. So something else, some more. So all of these are induced by the increasing oxidative phosphorylation. So what else? Just a second. So I think you guys already answered most questions of abnormal clinical symptoms seen in hyperthyroidism. Okay, so let's see again. Feel hot, increased hypersecretion, or increased body temperature, and the sweating, and the lose in weight, palpitation also, and that's all. Okay. Okay, let's move on to the question number 2. Calculate body mass index. What is the normal range? This is pretty easy one. Okay. Well, which group has not? I think group 1. Group 2. Which group has not answered yet? Or group has answered already? Okay. Group B8. Diva Putri, could you tell me the body mass index?
Okay, Prof. First
Yes.
of all, I would like to say thank you for the opportunity.
Yep.
So as my group answer, the answer is weight per height. What?
Body mass index is what? How much?
The normal range is 18.5 to 24.9.
Yes. And how about the body mass index of this patient?
Okay, roughly. $18.9.
Okay. All right. Thank you very much. That's good answer. Okay. Roughly 19. So she's very slim, right? Right. Okay. Thank you very much. Okay, what is the difference between free T4 and total T4? So free hormone, what is the difference between free hormone and total hormone? Okay, most all groups have answered, right? Okay, so I will go to the second round. Okay, I'm gonna move on to the B5 second round. Fitri, could you tell me the difference between free hormone and total hormone? Could you tell me the difference between free hormone and total hormone? Fitri, you hear me? Fitri.
Yes, Prof.
Yes, please. Could you tell me the difference, free and total?
Total hormone is hormone that bind with other substance, Prof.
What is free?
Free hormone is hormone that is not bind with another protein.
Okay. Roughly, your answer is correct. Okay. Thyroid hormone is lipophilic. Thyroid hormone is lipophilic, so it cannot be dissolved in serum very well. So it should bind with other protein, as she mentioned, such as thyroxine binding globulin or transthyretin. So this is called bound hormone. Bound hormone. On the other hand, some hormones still exist in body without binding to other proteins. So this is called free hormone. So why we usually measure free hormone rather than bound hormone? Okay, group A2, risky. Group A2, risky. Could you tell me why we measure the free hormone rather than bound hormone? Could you? Risky. You hear me? Rizky.
Rizky silakan di-unmute.
Yes,
Please.
yes, Professor.
Yes, please.
Because the hormone is bound the globulin in the circulation.
Mm-hmm.
Yes.
Yes.
The hormone measure what is not bound and able to enter and affect the body tissue and travels into that body tissue that as hormone. Both hormone attached to protein that prevent it from entering this tissue.
Okay, perfect. Thank you.
Thank you,
Yeah,
Professor.
okay, that's true. So free hormone can enter the tissue, but bound hormone cannot enter into the tissue. So it is free hormone that determine the tissue thyroid hormone level. So if free hormone is high, the tissue become hyperthyroidism. So it is important to measure free hormone rather than total hormone. Okay. So let's move on to the question number 4. So double T test finding showed TSH low, free T4 high, free T3 high. So why this laboratory finding is caused? Okay. Group D13, Zaki.
Yes, Professor.
Yes, please.
So the serum THS is low. It is probably because the thyroid hormone in the blood, the T3 and T4 hormones, is making a negative feedback mechanism to the hypothalamus.
Yes.
So the hypothalamus will decrease the production of TSH, whereas the T4 and T3 hormone is above the normal level. It is because even though the TSH is low, but there are antibody from the immune system that mimics the TSH and bound to the receptor of thyroid gland. So it stimulates the thyroid hormone secretion.
Okay. Okay, thank you very much. It's almost perfect, except TSH is secreted from anterior pituitary, not hypothalamus. Hypothalamus produces TRH, which can stimulate TSH, right? So, but your question is great. Thank you very much. So, decrease in TSH is a result of negative feedback by elevated free T3 and free T4, right? And the increased free T3 and free T4 is induced by the TSH receptor onto antibody. Okay, thank you very much. It's a great answer. Okay, explain why the beta adrenergic receptor blocker were given. Okay, thiamidol, okay, first discuss about beta adrenergic receptor. Okay. Group A1, Kurota. Could you tell me beta adrenergic receptor was used? Receptor blocker was used. Okay. Could you tell me? Kurota, you hear me? Probably you should unmute.
Silakan Dek, dijawab Dek.
Yes, Prof.
Yes, please. Why adrenergic receptor blocker was used?
In hyperthyroidism conditions, the levels of thyroid hormone produced are very large and excessive. So the patient is given thiamazole to reduce the rate of formation of thyroid hormone. Then beta adrenergic blockers are given because most of the symptoms of hyperthyroidism are symptoms that arise from sympathetic stimulation. In addition, beta adrenergic blockers can also inhibit the conversion of T4 to T3 in the periphery, thereby reducing the level of active thyroid hormone or T3 in the blood. Thanks, Prof.
Okay. Yes, adrenergic receptor blocker can inhibit sympathetic nerve activity, but beta adrenergic receptor, the main reason of using beta adrenergic receptor is to relieve some symptom. So the beta adrenergic receptor is given to relieve the most common symptom induced by hyperthyroidism. So which symptom? So the beta adrenergic receptor is effective in inhibiting which symptom induced by hyperthyroidism? Okay. D15. Alifia. Alifia.
Yes, Prof.
Yes, please.
Okay, I will answer these questions.
Yes, please.
The beta blockers gonna block the B receptor in SA nodes of the heart in order to regulate the heart rate and protect the heart. That's why the B adrenergic receptor is used, Prof.
Wonderful. Yes, that's correct. So the beta adrenergic receptor inhibit reduce the heartbeat because beta 1 receptor is highly expressed in heart, right? So the every node, SA node, express a large level of beta 1 receptor. So inhibition of beta 1 receptor can reduce the heart rate. So palpitation can be inhibited. Okay. So the thiamazole, on the other hand, thiamazole, I told you, was to inhibit thyroid peroxidase. So inhibition of thyroid peroxidase can induce what? So D14, Fahira, could you tell me inhibition of thyroid peroxidase induce what?
Okay. Wait, Prof.
Yes.
Inhibitor of thyroid peroxidase because T4 is important in iodination triglobulin. Yeah.
Okay, good. Yes, that's true. So the thyroid peroxidase mediates iodination of thyroglobulin and coupling of thyroid hormone. So as a whole, inhibition of thyroid peroxidase can inhibit thyroid hormone synthesis, reducing the thyroid hormone level. Okay. Okay, wonderful. Thank you very much. Okay, question number 6. Explain why calcium level dropped after surgery. Okay, group A4, Regina.
Yes, Prof. This
Yes.
a while. For our group, we answer for number 6 is actually the answer that we have is decreased calcium levels caused by surgical removal of the thyroid gland, which also removed the parathyroid gland, which secrete parathyroid hormone, which is useful for controlling calcium levels. Hypokalemia or low calcium levels can cause convulsions without concomitant tetany because low ionized calcium concentration in the cerebrospinal fluid are associated with increased excitability in the central nervous system.
Okay, almost perfect. Thank you very much. Yes, this sometimes happens. Removal of thyroid hormone also may remove the parathyroid gland. So the parathyroid hormone regulates to maintain the calcium level in serum. So the decrease in parathyroid hormone can reduce the calcium level. The calcium is important to maintain the excitability of neurons and muscles. So calcium level decrease can induce convulsions by the abnormal excitation of neurons and muscles. Okay, wonderful. Thank you very much. So I'll give you additional information. So in case of thinking or using clinical cases, you always have to think about the direct mechanism of the abnormal symptom, causing abnormal symptom, okay? Of course, you have to know the mechanism of hormone action, but hormone action can cause various symptoms, but there is a direct reason why such symptom is induced, okay? So based on that, I'll give you the additional information that you could download right now. Okay, you can download additional information that I give you, and I give short lecture using this. So again, this is a fundamental issue that you need to know about oxidative phosphorylation. Okay, so ATP is mainly produced in TCA cycle and glucolysis, right? So but it is not TCA cycle that directly make ATP. ATP is produced by NADH plus H plus or FADH2 produced in TCA cycle with oxygen. Both of these are combined in mitochondria. I don't want to talk too much in detail, but these are used in mitochondria and produce ATP. So catalysis of ATP can produce heat and can activate chemical production. So that's why thyroid hormone can activate both protein synthesis and catalysis. So thyroid hormone act both Okay, this is very important. So as a result of heat production, body temperature could be induced. And as a use of large amount of oxygen, palpitation could be induced. Okay, of course, sympathetic nervous system is also activated, but thinking about that there are major action of thyroid hormone, this system is very important to consider. So the activation of T-cell cycle induced the glycogen to break down, triglyceride to break down, protein to break down, and produce more ATP. Okay? And also, this is a little bit different step to remember, difficult step to remember, but if you think about piece by piece, it is not difficult. And the important thing that you have to know is thyroid hormone is the only hormone produced outside of the cell. You know, other hormone is produced inside of the cell, but the thyroid hormone is mainly produced outside of the cell. For example, iodine is uptaken together with sodium, right? Then iodine is transported to colloid, into colloid, okay, and secreted. Then thyroglobulin is synthesized and again secreted into the colloid. Then H2O2 is synthesized. Then together with thyroid peroxidase, it induces organification residue or iodination of thyroglobulin, produce diiodotyrosine or monoiodotyrosine. Then the same thyroid peroxidase can produce coupling of iodinated tyrosine, producing the T3 or T4, and the most T3 very little, most hormone, most produced hormone is T4. Then thyroglobulin together with T3, T4 is uptaken by endocytosis. Then it is catalyzed by lysosome, and MIT and DIT is also further catalyzed. Iodine is reused, but T3 and T4 is produced by hydrolysis and secreted into bloodstream. Okay. Then TSH activate most of all these processes through phospholipase C or adenylyl cyclase. Okay, and thyroid hormone receptor autoantibody bound to here and activate further the TSH receptor. Okay, this is the whole feature of thyroid hormone synthetic pathway. It looks a little bit difficult, but if you consider stepwise, it is not so much difficult. Okay, then finally, let's talk about feedback. So this is TRH, which is produced in hypothalamus. So TRH is synthesized in a very strange manner because TRH consists of 3 peptides: glutamine, histamine, proline. So the in pre-TRH gene, it contained 1, 2, 3, 4, 5, 6 TRH precursor. So the catalysis of pre-TRH, you can produce 6 TRH molecule, which act to pituitary, and then TSH secreted from the pituitary and stimulate thyroid hormone and the target organ, act to the target organ. So hypothalamus TRH secretion is stimulated by cold weather through noradrenaline neuron, or leptin can induce hypothalamus to produce thyroid hormone because when you're full, you need to break down the nutrients. So metabolism is increased with food, okay? But on the other hand, hungry, when you feel hungry, TRH secretion is inhibited, causing decrease in body metabolism. Okay, so you may have taught only this feedback loop, but you have to think more about physiology and thyroid hormone secretion. Okay, so cold and food can regulate thyroid hormone secretion through TRH. And TSH structure is like this. And the TSH consists of TSH beta together with alpha. And alpha is common with LH and FSH. Okay? And TSH action is to stimulate thyroid hormone synthesis, but also TSH can proliferate follicular cells. So if thyroid hormone is TSH is high or TSH receptor is stimulated, then you have a goiter, okay, swelling of the neck. Okay, goiter is induced by the TH receptor antibody like Graves' disease, but also hypothyroidism. Hypothyroidism can also induce goiter. For example, Hashimoto disease. In Hashimoto disease, thyroid tissue thyroid tissue is destroyed. So the TSH is activated because of a negative feedback, right? So reduced thyroid hormone can induce the TSH to secrete. So the even in hypothyroid case, goiter is induced. So both hyper and hypothyroidism may induce goiter. This is also very important thing that you have to remember. Okay, so finally, I'd like to discuss a little bit about the mechanism of thyroid hormone action. It activates transcription of target gene. So again, T4 is converted T3, which is active form of thyroid hormone, which can enter into the cell through thyroid hormone transporter. Then it binds with thyroid hormone receptor, and the thyroid hormone receptor forms heterodimer with retinoic acid receptor. So the thyroid hormone receptor from heterodimer with RXR or retinoic X receptor, and it activates transcription by binding with cofactors. Then RNA polymerase is activated, and messenger RNA is produced, and it causes protein, and physiologic action is induced. Okay. So cofactor is important. Okay. So that's all for this morning session. Do you have any questions or comment? If you are really shy to answer orally, you can just send me the chat.
Silakan adik-adik berikan satu komen, silakan.
Yeah.
Pertanyaan boleh ataupun komentar, silakan.
No question?
Silakan terkait TBL juga boleh Dek, silakan dikomentari.
No question? You sure? Everybody is a little bit shy. No question? Okay, you sure? My lecture is so insightful. Okay, I don't know. Okay, anyway, so I hope you enjoyed my TBL. Maybe this is your first experience, and probably you come to know how you think about the symptoms. Okay, you always have to think about the direct consequence. Okay, if no question, I will close today's session. Okay, thank you very much.
Okay, Prof. Maybe some of you still wanna ask Prof. Nori?
Okay.
Regina, maybe?
Yeah.
Okay, please. You can give a comment. Okay, thank you. Please, Regina.
I don't really have a question about the TBL because I feel like I need to learn more about it to actually understand it. So I know what I don't understand really. But for the comment for today is that the TBL teaching is really fun, and I think that the questioning session where the professor keep on asking the question to the students is quite nerve-wracking because we do not know whether we're going to be asked or not. I think that's my comment for today's class. Thank you.
Okay, thank you very much. If you guys enjoyed my TBL, I'm very happy. Okay, so next session will start in 30 minutes.
Okay, so the second session will start at 12:50 in schedule, Prof.
Okay, 12:50.
Is it okay?
Yeah, sure.
Okay.
Okay.
I think in this second group discussion, they have to clean faces and bust like race against time. Actually, we are very proud that you're able to finish on time, students. Although later we have to confirm it with Prof. Nori's mini lecture. But we really appreciate your efforts and thank you very much for your active participation. And Prof. Nori, thank you very much for giving your valuable insight. All of you can unmute and say thank you directly for Prof. Nori, maybe.
Thank you, Professor.
Thank you,
Prof.
Nori.
Thank you, Prof. Arigatou gozaimasu, Prof.
Thank you, Prof. Thank you very much. Thank you very much.
Thank you, Prof.
Okay, thank you so much. Okay, so we will end of this session. Thank you very much for participation. Okay, bye now. Okay.
Bye-bye. Bye-bye, Prof.
Okay.
Bye-bye, Prof. Arigato, Prof.
Bye-bye, Prof. Arigato.
Arigato, Prof.
Matur nuwun, Prof.
Silakan live ya, Dek.
Okay, I'll close. Okay, I'll take some lunch and see you again in 30 minutes. Okay,
yes,
thank
Prof,
you.
Go ahead. Okay, Prof, thank you.
Thank you.